Go!
I've been involved with sports my entire life since I was like 3, playing baseball at the house league, just coming up through the program there, and I've loved sports forever.
I just love being out there on the football field that much and going out there to take kicks just to get that game-winning field goal. It just mean the world to me.
I'm involved in marching band and lacrosse. I really want to be in marching band when I go to college, for sure.
I'm Lila Lazarus. When you're involved in sports, any sports, injuries happen no matter how old you are. Sports injuries are on the rise. And our children are playing sports younger and younger, sometimes the same sport year-round. The result? An increase in overuse injuries. And when it's your child or your knee or your shoulder, and you want to get back to your sport, where do you turn?
Here for you, we're gonna make it through together. You and I will find our way.
These are the real stories of the patients, medical, and support teams of St. Joseph Mercy Health System, whose lives intersect for a brief moment in time to achieve remarkable outcomes.
We bring hope, we bring love, we bring our strength, and all we're made of. You and I together.
He's played sports his whole life, played many different sports. He loves to compete.
Any chance he gets to play, that's what he's doing.
There's no better feeling when you see the ball go between the 2 yellow poles. I can't even really explain it. It's when you just high-five your holder and go hit helmets with the long snapper. That's fun.
When he decided that he fell in love with being a kicker, as a mom, I was so excited. I'm like, great, nobody's allowed to, don't touch the kicker.
I do worry about him getting hurt.
There's some big boys on the football teams these days, so it does get scary.
More kids are playing sports more intensively than ever before, with more injuries than ever before.
My son was injured in baseball, and it was a difficult road.
I was stretching to make the play at first, and the kid stepped on my foot as I went by and dislocated my knee, which eventually caused me to tear the cartilage off my knee.
He's a football player, also in marching band, and it was difficult to watch him go through this.
Football is my main sport, and I'd worked really hard my freshman year to earn the spot on the team. I went to every practice, and I went to every game, and I went to every event the team had, and I was there, I was part of the team, but I also wasn't. And it hurt a little bit, because I watched a guy play in a spot that I was going to play in.
I was playing lacrosse. I jumped up and I tore my ACL then, and I fell down and I was like really upset.
The most common injury that we're seeing right now is going to be the ACL tear.
She had swelling in her knee, and then we knew that something was really wrong.
She was crying, she was very upset, and they had to practically carry her off the field. So we knew that she'd sustained more of an injury at that time, and then her knee was swollen, and took her to the doctor right away.
I felt like a pop in my hip, and I kind of shook it off originally. Into practice, I started to feel it, and it started coming back every day. The day before the game, I'm like, oh no, it's not going to be good. I kind of decided that I'm going to play through it. It kind of popped again. I'm like, this time it really hurt. Coach comes up to me and says, can you take this next kick? Of course, I'm going to say yes, because it's every kicker's dream is to take that last second kick, you know. And I thought about it for a second. That's when I kind of decided to let the other kicker take it.
You see him injured, it's, you know, your heart just breaks.
And all you can think about is getting back out there and keep playing.
We didn't know what it was at first, and I think that was the scariest part.
There's nothing you can do about it, you're injured.
But at the same time, that's kind of my dream to kick, and I never thought I'd get that again. The worst moment was when I came into the locker room here. I was already upset. I took my pads off, and Coach calls his meeting as usual. We go over there, we talk, and they started chanting the other kicker's name. I feel the competition's getting better. As competition gets better, people play harder and then push themselves even through injuries. It ends up injuring themselves more and more and more, and I feel like it's building.
It is building. Surgeons see two alarming trends. First, a skyrocketing number of young people with sports injuries. And second, injuries once reserved for the pros, now seen in younger and younger ages. It seems like it's an epidemic.
It really is. There's more and more people that are getting this problem. Athletes are getting bigger, faster, stronger, and the joints aren't keeping up.
The athletes are trying to do
a lot of things that they've never done before. When I was in school, I don't remember it like this. It's really, really scary.
Kids are overtraining nowadays, and we need to put proper training in the place of overtraining. Overtraining hurts people.
He works year-round on his kicking, and to think that it could be gone in a single game, my heart was breaking for him. You can play hurt, but you can't play injured.
To achieve that starting position, to achieve that goal, that pinnacle, and then to have it taken away sometimes so quickly, it can be very difficult.
Dr. Aalderink, our school doctor, my trainer recommended him.
He gets them in quick. I mean, he does everything he can to get the kids in.
Yeah, that's what's so great, because when Vinny was injured
Yeah.
that week, I'm thinking, oh, you know how it is trying to get into the doctor. I called and they got him right in.
I'm an orthopedic surgeon, board certified with fellowship training in sports medicine.
He knows a lot about football and injuries.
I've been at St. Joe's now about 6 years.
On any given Football Friday, you can find Dr. Aalderink on the sidelines of a football field. Here in Saline, for example, he knows the team inside and out. Half a dozen of these players are his patients, including one member of the marching band. What happened to Megan?
Megan tore her anterior cruciate ligament, or her ACL. We've seen a huge increase even in the last few decades for the number of ACL surgeries that have been done. And the question is, why are we seeing so much of this? Kids starting at a younger age, playing higher level sport, from one team sport into a club sport into a school sport, and you're just not getting that recovery time that a lot of us had when we were kids. We see ACL injuries happen in females about twice as commonly in their male counterparts. We see kids starting at a much younger age and being pushed to much higher, more aggressive levels than previously seen. Soccer players, lacrosse players are at the top of that list as far as injury prevalence. Even things like marching band, which is a very active sport and can actually require a lot of physical strength to get through marching band.
You were in marching band.
I was in marching band. I participated in the marching band in my freshman year at University of Michigan, where I was a member of the drum line.
So you understand her concern.
I do.
Good pass, good pass, good pass. There we go. When you have a passion for something in life and pain stops you, it's almost a depressive state because you can't fully participate in the thing that you're most passionate about. Come on, tempo, 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 tempo. Good.
Tim DeBelso is the assistant volleyball coach for Madonna University.
Now, up.
But excruciating back pain took him off the court.
That pain was getting worse and worse each season. I thought, if I don't do something, I can't do this anymore.
I wouldn't even go down and pick up a volleyball because I knew I may not get back up. The pain hit me, shot through me like a bullet. I literally fell to the floor. That's how debilitating the pain was.
I would tell myself, you're not helping these young people the way they need to be helped. I don't think I can do this. I think this is the last year I'm going to be able to do this.
It was heartbreaking because I know how much he loves coaching. It was a hard conversation to have.
Can you describe the pain at its absolute worst?
Like a knife stabbing you. It literally was that excruciating. Decided on surgery after I met with Dr. Karaginas at St. Mary Mercy Hospital.
You didn't just want surgery, though, to relieve the pain. You still wanted to be an athlete.
I was a high school athlete. I've been a coach for over 30 years. Coach high school football, and now I'm doing collegiate volleyball.
Up, up, up. Good.
I couldn't cut the grass. I couldn't push the lawnmower. I could not rake leaves.
I wanted him back to the way he was when I met him. To see him in pain like that was very difficult.
Hey Ryan, do you have the other tendon harvester?
But athletes want to avoid surgery or any procedure that keeps them out of the game. Surgery is not an easy decision.
Surgery is never an easy decision, and surgery should always be one of the last resorts. Unfortunately, for certain injuries, the best way we have to normalize and restore the mechanics, unfortunately, does sometimes require surgery.
Sometimes the injury leaves you with no choice, like Megan's torn ACL.
My biggest concern was getting her back to play. I mean, this is a devastating injury for young athletes, and the last thing they want to do is have to lose any time from sport. So it's always a difficult discussion to have to sit there and tell them, look, this is going to take 9 months to a year where we need to take you away from that sport that you love to get you through this process and get you back on the field.
Anytime your child goes to have surgery, it's really scary. I'm worried about it. You don't want your child to have any pain, and you don't want them to suffer. Even though you have confidence, it's still surgery.
All right, here we go. Field goal. Oh, sign him up. Jim Harbaugh needs a new field goal kicker. We got two little boys, Lucas and Tyler, 8 and 6.
My name is Tyler. My name's Lucas.
Like sports? Focus. There it is. I like to play outside in the backyard.
My mom is a kid doctor who works at IHA. My dad works at St. Joe's Hospital, and he fixes people's bodies and bones.
So he's Mr. Jack of all trades.
Good at fixing people.
He's, I think, a great physician, great with patients, great father.
What's the biggest advantage to being married to a doctor?
Go ahead, you can go first.
Free medical advice.
It just helps to have that understanding to know what the demands of the job are.
You have that common ground that you can talk about and understand each other's lives.
What's your focus when it comes to your boys?
We want them to learn that it's important to work hard in life and set your goals high, but really strive toward those goals, but have fun while you're doing it too.
What do you think you want to be when you grow up?
Football player? Yeah, maybe a football player.
It's more important to do 2 or 3 different sports in a 12-month calendar year, not just the same sport year-round. A second grader doesn't need to do soccer 12 months out of the year.
Hey, Tyler, you want to play?
Good morning.
Morning. Welcome to St. Joseph Mercy Chelsea. My name is Natalina, and I'm going to get you started today.
We're going to do everything we can to get her back on the field. That's the goal going into it.
She's very worried about both marching band and lacrosse. She does not want to miss out on her high school years.
We're going to make Megan a new ACL. We're going to restabilize that knee, and part of that's going to involve taking one of the tendons around her knee and then drilling some sockets in the bone that we're going to pull that tendon up into that socket to stabilize the knee. Good morning. How are you guys? You ready?
Yeah.
Megan's holding together well. I think she's definitely the rock. I think mom and dad and the rest of us seem to be more nervous than Megan.
So Megan has a big road ahead of her. I mean, ACL tear with a possible meniscus, we won't know until later today.
It usually takes about an hour. I mean, a lot of that will depend upon the integrity of the meniscus and whether or not there's a meniscus tear or not as well.
For parents, anesthesia is often a big concern.
Of course, the biggest anxiety that parents share is that their child is going to be okay after.
I hope everything goes well, and I want her to come through it with flying colors, and then we're going to take the next step and move forward.
Fortunately, in this day and age with anesthesia, risks of anesthesia are actually very, very uncommon, and we're able to care for the patients in a very safe and effective way.
We're doing a left knee ACL reconstruction with auto hamstring, possible meniscus repair. And left knee is the correct knee. Everybody agree?
Left knee.
All right. And we're going to take just one of her tendons to fold it up to make a new ACL. We got our hamstring tendon identified and protected here. Oh, there is definitely no ACL attached here. There's the stump of it right there where it pulled right off of the bone. That would definitely be good for Megan if she does not have a meniscus tear.
I pray that Megan has the speediest recovery, that everything goes real smooth for her, and that she commits to it. I mean, it's going to be a long haul for her, but I think that she has all the right kind of support in place.
This is where we commonly see meniscus tears with ACL injuries, and everything looks great back here, so that's definitely a win for Megan.
Dr. Aalderink is awesome. We've heard he's one of the best. I have confidence in all the doctors at St. Joe's.
All right, good. So there's not any meniscus that we have to worry about, so we'll be just getting this ACL put back together and we'll be good to go. Yeah, I like it. Okay, that's in there, so yeah, that's good. And the chew test here, solid. Doesn't move anywhere. Thank you, guys. Fortunately, the meniscus was fine, so we don't have to worry about a meniscus repair, so that'll help make it a little bit easier in the short term early on, kind of getting back to full activity. But yeah, I think she's going to do great. Can we put parents in a room, please? Hi, guys.
Hey, how'd it go?
Everything went great. I'll show you some pictures here. The nice thing was the meniscus was not torn. She had a nice firm endpoint afterward. I mean, the knee feels nice, rock solid, which was not the case when we started. For the most part, especially at night, you really want to keep it straight. The bandages can come off on Saturday. Just up and wrap everything kind of from the thigh all the way down. Good?
Thanks a lot.
If you make the coffee, I'll get the mugs. I have our Amsterdam Netherlands mugs.
I had a lot of trepidation about what was my life going to be like after the surgery.
This is a long recovery process. It doesn't end on the day of surgery when you go home.
Was I really going to be pain-free?
So I'm going to take you through a couple screens. I want to find out movements that are difficult but don't hurt.
Was I really going to be able to get back to the life that I knew that I wanted to get back to?
5, hold it there, okay?
This really takes a dedicated team after surgery to really help take the athlete from the surgery and get them back on the field.
4.
Is there anything in Southeast Michigan that even compares to this?
Stop. Excellent.
We like to think that we have something unique here at St. Joe's through our physical training programs and our sports medicine fellowship trained surgeons.
There's not a lot of sports specialized physical therapy clinics and training centers.
It is unlike any other rehab facility I've ever walked into.
Good, good, good.
What makes MercyElite sports performance so special, so unique?
It doesn't look like your typical hospital clinic room setting. Put your arms up, and I'm gonna grab the hands, and I want you just to spread your feet out and kind of sit down.
You want to get better. You want to look better. You want to feel better. You want to perform better. So we built a program that helps people do those things.
We all learn and we get coached how to throw a football, how to throw a baseball, how to kick a soccer ball, but nobody ever teaches you how to run, how to walk, how to jump. And so that is the key inherent basic building block for sports, is the simple running, jumping, landing. And that's really where a lot of this begins.
It's an environment that just says, we're here to work and we're going to work on those things that are going to allow you to get back to your life.
We have the weekend warrior and we have the elite athlete. We also have the peewee athlete.
If you're looking to get back on the field, you need to have a specialist who knows how to take you from onset of injury all the way back to performing at your highest level. You can have basketball players, lacrosse players, power lifters, marching band athletes. We encountered a lot of parents in the marching band area that said, you don't understand the demand that our marching band athletes put on their bodies. Can you help them? And we said, of course we can.
They're movers, they're active, and they're passionate.
We really pride ourselves on having the full team approach. I may be there orchestrating things as the conductor, but it's a matter of making sure that the athlete gets the care that they need at every step of the way.
So you're not just healing the wound, you're turning them back into athletes.
We're trying to get them back to where they were before the injury happened.
6 weeks after Megan's surgery, she's well into physical therapy at Probility.
What's great about Probility is the fact that we work with people from 5 years old to 95 years old. There's a real loss and a trauma after not being able to do your sport. We work with people, not on just their knee, but on their emotions, on their psychology, on, what's important when they get back to actually playing their sport again.
Do you want me to go all the way down to the chair?
I want you to go further back.
We just have a really good group of therapists here and a really good team approach, and it's just going to help get Megan back as soon as possible and make sure she maximizes every minute that she's in physical therapy.
Our goal is that we make them so strong and so stable that they never injure their knee again.
Throughout the process, her doctor has continuous communication, first with the physical therapist.
Hi guys. Hey. Welcome back. 6 weeks now. How are you?
Good to see you.
Are you still doing your physical therapy with Probility?
And later, with her sports trainers at MercyElite.
Keep that weight over the front leg. Tap the back foot.
Probility and MercyElite are both part of St. Joe's.
9 months kind of being the magic number, and we're going to make every effort to get you to that point, and that's where the therapy is going to be critical, getting it stronger, starting to introduce some of that and ramping you up, and we're going to let you fly. As long as she works hard and we encourage her along the way and we take it slow, I think she's got a very good prognosis to get back on the field.
It was clear Dr. Aalderink knew exactly what was wrong with him. The tendon was rubbing across that bone, and that's what the popping was that Vinny was feeling when he was kicking.
It was amazing how quickly he was able to figure out where we were at, what we needed to do.
I did exactly what he told me to do.
Bridge up for me.
Recovery is work.
Recovery takes a long time, and unfortunately it's an active recovery. It's not something that's going to just happen on its own.
My heart really goes out to them. It's really difficult. My own son went through the same thing this last year. It was very difficult. I guess it's given me another level of compassion for them. Knowing how long that road is and how difficult that road is.
I had to sit in a machine for 6 hours a day that kept my leg moving so that my joints wouldn't freeze up.
Alex had actually knocked off a piece of that crucial cartilage or coating on the end of the bone, and it was floating around inside his knee.
God, this is going to be me now. I'm not going to be able to get back to my sport.
Perfect. Our surgery was designed to try to get him back to playing sports.
The reality is not everybody's getting back on the field.
Correct.
What's that like for you as the doctor?
Sometimes it happens and sometimes it doesn't. And there's always instances where athletes careers are ended by devastating injury, their hopes and dreams can go away in a second, and it makes it really tough. It's always my goal, getting back on the field healthy, strong, to be able to achieve and go as far as they want to go.
Megan's concerned that her marching band career, her lacrosse are over.
And ready, go.
When an injury happens, what happens to the athlete's dreams? At first, it's always devastating.
I was just a nervous wreck. I was shaking and scared.
When we come back, sometimes it turns out better than the athlete ever dreamed.
You couldn't have written it any better.
Need to fill the bird feeder.
All right.
I think it's great that he has his life back. Mowing the lawn and raking leaves is also a plus.
You're getting up every morning going, I've got this to do, I'm looking forward to that to do, I've got practice to go to, we've got a match on Saturday.
Come on, come on, come on, pick it up.
2 or 3 years ago, I couldn't bend over. It's finding those people that you can trust that will help you get back to the life that you want to live. And those people for me were the people from MercyElite.
Did you have confidence that they really knew what they were doing?
I had absolute confidence. It's small steps. Little by little by little, they give you the exercises, the attention, and the time to allow you to make those gains pain-free.
We're both really happy. We're both healthy. There's not much you can ask for. We're really blessed.
Good job. Come on. You're up. I'm running around the volleyball court. I'm doing things that I used to do 20 years ago and never even thought a second about it. My experience with MercyElite told me that they had the ability they could help our volleyball team. We worked with MercyElite to do a preseason assessment. We had the most injury-free season after that assessment. It's just been a life-changing, life-reaffirming experience. It really has.
You're back on the court.
I'm back on the court.
How about those people sitting at home who are injured, who think their athletic career is over? What do you say to them?
Get in to see a specialist, even if it's starting with your primary care physician. Get in to see somebody so we can at least help bring you into the loop and help make things better.
This is a great atmosphere out here tonight.
They did such a phenomenal job with Vinny. I never thought he was going to come back and have an opportunity to begin kicking again that fast.
How's it feeling?
Good, it feels so good.
So when you're out there moving around, show me that little move you were doing a minute ago. So you're talking about backstepping and then twisting. Yeah. It feels okay?
Yeah.
Break a leg? Oh wait, no, don't say that. Just kidding. Good luck out there.
There's nothing more gratifying than seeing an athlete that can get back to playing that sport, but excelling at it, really excelling at it, and going to the next level. It's just really neat to see these kids get back to doing what they want to do.
I thought that I wouldn't be marching this season. I thought I'd be sitting out right now. And it feels awesome. I'm so glad to be back on the field.
I burst into tears the first time he ran out on the field. So happy for him. He did work really hard. He was really patient. He stayed really positive.
It's one of the best feelings in the world to be back out there with my guys, with my friends, with my team, and to know that I'm healthy and know that my knees are 100% and I'm working out there with my boys.
Having to battle back from that injury and then get back into that lineup has been huge for him. I couldn't be prouder.
Just to come back again and healed and ready to go and have a chance again.
It's good to see your patients as athletes back on the field.
It's awesome. It's unfortunate when an injury happens, but it's great to have a good team of support around you. I mean, it starts with the athletic trainers on the sidelines assessing things, and then obviously making the judgment call to get them referred into us at St. Joe's to help kind of take them the next step of the way. And so it's part of that whole team approach that we talk about, having sideline trainers, having the physicians, and then really having the physical therapists and everybody involved to help get them back on the field.
I think he's great. He's a lifesaver. He gave me back my sports career, he gave me back being with my team, he gave me back being with my friends, and he gave me back all this.
The odds of taking a last-second kick are near zero in a high school season.
Vinny didn't kick at all Monday, Tuesday, or I think Wednesday, I believe.
Wednesday, yeah.
They wanted to rest it, so we just didn't know what was going to happen when he went to kick. A mix of emotions because we thought we were going to lose the game, you know, because we were down by 1 point, brought the field goal unit out. You couldn't have written it any better.
I was just a nervous wreck. I was shaking and scared, and nobody was talking to me because they knew better in the stands because I couldn't even hold it together.
I've never thought in a million years would I ever have a chance to do it again. When coaches trust you to go out in a situation, you believe in yourself a lot more. We get it moved into about like the 5-yard line, and there's 7 seconds left. I remember coach calling my name saying, "All right, you're taking the kick." I was like, oh boy, here we go.
Vinny was injured last week, so they had to bring in the sophomore Turner to kick it, but Vinny's back healthy this week, and they're going to try and ice him, but he's got ice water running through his veins. He's ready to kick this.
I just remember running up to the ball, looking at it, and right off my foot, and once I saw it was going between the poles, I just turned and ran.
The kick is up, and it's good.
I just was so happy. I couldn't believe I got a chance, and I made the chance. It was just a thrill.
Your finalists, Lean 26, Bedford 24.
I think it lived up to its billing. Great atmosphere, great football, and a fantastic finish.
And everyone's chanting my name in the locker room. This time it was me, and I was just so happy when it was finally my name. I mean, it's just the best feeling in the world.
I was broken down to tears, I'll be honest. I was so emotional.
I just lose it. I'm like, oh my goodness, the emotions were just all over the place.
He got it right, Dr. Aalderink got him back on the field.
He was banged up at the end of last week. You guys were able to get him healthy this week. To be able to come back and get the game winner like that, I think is just huge.
If I didn't have the right care or right doctor, I wouldn't have been able to take that kick.
I want to say thank you very much for everything. Working on me, working with me, and being a friend along the way.
My pleasure.
We love Dr. Aalderink. He took really good care of us.
The hidden secret is the care that we get with the facilities that we have around here, and not only are they great caregivers, they're great people. So our kids and our families really respond to them. So I think we have it better than anybody in the state of Michigan, to be honest with you.
Don't give up. You know, if you're injured, we're going to battle through this. We're going to work together as a team. We're going to make sure that we get you healthy again, so that whatever that next step is, we're going to be there for you.
Really, at the end of the day, it's not about wins and losses. It's about seeing kids grow and having a wonderful experience, and that's what we saw tonight for a lot of kids. So it makes you really happy as a coach.
That's something Vinny's going to remember the rest of his life, and I know we will too. It was special.
Okay, call him up. Get set.
If you get injured, you don't have to give up on your dreams. There's a team ready and waiting to get you back on your feet and back to your sport. Maybe even stronger than you were before. I'm Lila Lazarus. Thanks for watching.